This is a summary to the anatomy of the femur. The femur, it is a long bone. It has an upper end, this part, then the shaft, and finally we have the lower end. Now let's talk about the upper end of the femur. It has head, neck, and greater trochanter plus lesser trochanter. What else we have? Anteriorly we have intertrochanteric line, as you can see it, obvious here. And if we turn it posteriorly, we have intertrochanteric crest. Let's go and talk about the head. The head has this depression here. We call it fovea capitis. Fovea capitis. For the attachment of ligamentum teres. If you go to the hip joint, there you would find that we talked about ligamentum teres, as it has inside it the acetabular artery, the artery of the head, to supply the head of the femur. Now let's talk about the greater trochanter. The greater trochanter receives the attachment of gluteus medius and minimus muscle. I may ask you in the exam about this structure, an arrow indicating this structure, then I'll ask you the indicated structure receives the origin, the insertion of which of the following muscles? Gluteus medius and minimus. I may ask you about their nerve supply, which is the superior gluteal nerve. I may ask you about their function, which is medial rotation and abduction. Let's go to the lesser trochanter. This is, as you can see, a bit posteromedial in its position. I may ask you in the exam about the structures attached to it. These are the iliacus and psoas, iliopsoas muscles. I may ask you about their function and nerve supply. Their function, they are the main flexors of the hip joint. Their nerve supply, of course, the psoas major is supplied by the lumbar plexus, while the iliacus is supplied by the femoral nerve. What else you need to know about the upper end of the femur? The neck, we will talk about it in the hip joint, as it is important for you to understand its blood supply. But this is something in the lecture of the hip joint.